Bismillahirrahmanirrahim. Quote of the day. According to Thomas Edison, opportunity is missed by most people because it is dressed in overalls and look like work. I am Dr. Hussain Mahmood. Today I am presenting on health policy and its analysis under kind supervision of my professor, Dr. Saira Afzal. Learning outlines. Today we will learn health policy, public health and health policy, policy process, health policy triangle, practical application of health policy, recent updates, and multiple choice questions. Learning outcomes. In the end of this presentation, participant will be able to describe health policy analysis triangle, and its practical application. What is health policy? Policies are general statements based on human aspirations, set of values, commitments, assessment of current situations, and an image of desired future situation. What is the difference between public policies and health policies? In public policies, authoritative decision made in legislative, executive, or judicial branch of government. In public policies intended to track or influence the action behaviors of decision of others. But in health policies, aggregate principles stated or unstated that characterize the distribution of resources, services, and political influences. It impacts directly on the health of population. According to WHO definition, health policy can be defined as the decision, plans, and action that are undertaken to achieve specific healthcare goals within a society. According to WHO, health policy can achieve several things. It defines a vision for future, it outlines priorities and the expected roles of different groups, it builds senses and informs people. Health policy development landmarks. Landmarks in the development of health policy was the worldwide adoption of Goal of Health for All by 2000 AD. Landmark for Alma Ata Declaration in 1978 calling all government to develop and implement primary healthcare strategies to attain the target of health for all, and more recently SDGs 2030. Health for all. All people in all countries should have at least such a level of health that are capable of work productively and participate actively in social life of community. Health is brought within the reach of everyone. It is holistic, a concept of effort in field of industry, agriculture, housing, communication, as much as medicine and public health. Spectrum of area covered by health policy, financing and delivery of health care, quality of care, access to care, and health quality. Category of health policies: global health policy, mental health policy, pharmaceutical health policy, policies related to public health, vaccination policy, tobacco control policy, and breastfeeding promotional policy. Mosby's dictionary defines health policy: statement of decisions regarding goal in healthcare and a plan for achieving that goal, for example, to prevent an epidemic, program for inoculating a population in developing and implemented. Health policy cycle. The first step in health policy cycle is agenda setting, then policy formulation, then decision making, then policy implementation, and policy evaluation. The first three is agenda setting. Issues become significant and draws the attention of policymakers. Health needs are measured, self-reports, health status indicators, biomedical measures of health status, and geographic variations. Policy formulation: the various stakeholders like healthcare teams, hospitals, and government are involved in the formulation of policy. Decision making: in this stage, solution is chosen that how the stakeholder decide to approach an issue. Policy implementation: to choose a solution is put into an effect. It is difficult stage. Policy evaluation: policy should be monitored and evaluated for its impact whether it is successful or not. Health system management level. As identified in the aforementioned definition, health management does not refer solely on one level of practice, but is quite broad process which occur in different levels instead. Holder and Ramazan 2012 refer to model adopted by Autumn 1999 to categorize management activities at the macro, meso, and micro level. In micro level health management system, health system policy level, attention, national health authorities. In meso level health services, network hospital facility managers. In micro level clinical management, healthcare providers involved in that provision of clinical cares. Health system management level. In micro level health system management policies implemented by government with the help of National Health Ministry for achieving national health goals. For example, National Program of Immunization. In meso level of health system management of health services and facilities for the population health needs and expectations. For example, provision of vaccination at all health facility centers. But in micro level, management level, direct provision of clinical care, for example, child cat vaccination. Health policy analysis. Health policy analysis is a multidisciplinary approach to public policy that aims to explain the interaction between institution interests and ideas in policy process. According to Bush et al., analysis means separating a problem into constituent parts so as to better understand its whole. Analysis in an application of knowledge represents the primary contribution of health policy analysis to governmental decision making. What is the 5E approach to policy analysis? These phases include engage, explore, explain, elaborate, and evaluation. Health policy triangle. Health policy triangle developed by Wald and Gulson 1994 for four element of policy analysis are context, why need this policy, content, what is the policy mainly about, process, how was the policy brought forward and implemented, actor who participate in the influence, formulation and implementation of the policy. The health policy triangle: content, process, content and actors. Content, ideas for policy, type of scale of policy, actors who makes and influence decision, power and how, whose interest and whose ideas in process, agenda setting, policy formulation and implementation in context, situational, structure, cultural and environmental. First of all, content, the objective, values, vision, service, models, guidelines, and implementation plans for child and adolescent mental health service in outlined. In actor, the range and characteristics of participant, individual, group, and organization in the policy development process, including their role, relationship, interest, agenda, and expertise in child and adolescent mental health. In process, the process followed to the consult key stakeholder across the government sector, non-government sector, and other relevant civil organizations. In contrast, the social, political, cultural, and health system context within which the child and adolescent mental health policy was developed. Health-related program in Pakistan: National Program for Family Planning and MNCH Primary Health Care, expanded program of immunization, National ADIC program, malaria and dengue control program, National Nutritional Program, hepatitis program, and COVID vaccination. Challenges in developed countries: weak regulation and monitoring system, lack of purchasing power, quality of service delivered, influence of political system, and reliance of external donor funds. Objective of national health policy: achieve an acceptable standard of improved health, increase access to public health system, ensure equitable access to healthcare, create new health infrastructure in area deficit, upgrade extend health infrastructure, promote public partnerships, suggest where to increase investment in health, promote effective monitoring and evaluation of front policies and implementation at district level. Forms of policy analysis. Two forms, prospective and retrospective. In prospective policy analysis involve the production and transformation of information before policy action. But in retrospective, these forms of analysis involve the production and transformation of information after policy have been implemented. Prospective analysis, it provides qualitative and quantitative information on which we make future decisions. It emphasizes on obtaining information about goal and objective of policies. But in retrospective analysis studies the data from policies that already have been put in effect. It is usually known as research. It shows that it does work at the micro level, place primary emphasis on the result of action implementation rather than that process. Why policy analysis is necessary? For health reforms was successful and failure, techniques and tools for study the characteristic of established policy, how the policies came to be, and what are their consequences, assess the outcome of health policies or the impact of policy on people. So policy analysis illustrate the need of intervention to think seriously about the problems. Now recent updates. This article published in 2023, Analysis and Evaluation of Health Policies in Iran through Policy Triangle Framework during the last 30 years, a systematic review of historical period from 1994 to 2021. This study aimed to analyze health policies during the historical period of almost last 30 years in Iran using Policy Triangle Framework. The main focus of most studies of the analysis was on the concepts and process of policies as the element of the policy triangle. The main focus of health policy analysis studies in Iran over the last 30 years was on the context and process of policies, although range of actors within the outside the Iran government influence health policies, but in many policy processes, the power and the role of actors are played involved in the policy are not recognized carefully. Also, Iran has suffered from lack of proper framework for evaluation various implemented policies. This and other article also published in 2023 using healthcare policy and system research to influence national health policies, lesson from Mexico, Cambodia, and Ghana. In this article, they investigated the varied experience of health policy and system research in Mexico, Cambodia, and Ghana. He selected purposely as a strong example of reflecting important lesson under varying conditions to illustrate the way in which health policy and system research is used to influence health policy. We reviewed the academic and grey literature on policy documents, constructed 3 countries, case studies, and interviews 2 leading experts from each of Mexico and Cambodia and 3 from Ghana, using semi-structured interviews anonymized to ensure objectively. The result demonstrates that health policy and system research play a varied but essential role in effective health policy making and the use of implementation and outcome of research and research-based evidence occur inevitably within the national context that is characterized by political circumstances. The infrastructure and capacity of the research and the long-term experience with the health policy and systems research process, this Analysis of national experience of demonstrate that the embedded health policy and system research is the policy process in which in both possible and productive under varying economic and political circumstances. Supporting research started with social development legislation establishing relationship based on the trust between surgeon and policymaker and build a strong domestic capacity for health system research. All demonstrate means by which of the value HPSR can be materialized in strengthening health system. This another article published in 2022, Health Policy Analysis in Eastern Mediterranean Region using a health policy triangle framework, historical and ethical insight from the form of a systematic review. This paper aimed to collect systematically the studies using a health policy triangle framework in doing analysis in one of the health policy issues in the Eastern Mediterranean region organization. Method to conduct our literature search, ISI Web of Science, PubMed, Medline, Embrace, the Cochrane Library, Global Health Database book, as well as Global Scholar from 2020 to 2003 up to June 2020 was systematically mined to evaluate the methodological quality of the included study of the critical appraisal skill program checklist was used. According to the finding of this study, the Eastern Mediterranean region, organization region, and the role of evidence-based research in policy making has been repeatedly emphasizing, but its use in health program decision making has been limited. And health research system in Eastern Mediterranean region organization are still under scrutiny. There is a still gap between evidence-based research in health system and its use in policy making. Based on present systematic review, studies based on policy analysis should focus on all the element of health policy and provide evidence to inform decision that can strengthen health system, improve health, and improve existing inequity qualities. Now it's time for MCQs. First MCQ, the fourth National Immunization Campaign for year 2021 reached across the nation in December to vaccinate more than 40 million children under 5 in 156 districts. During the campaign, several social and cultural problems were reported according to the health policy triangle. This problem lies in which section? Context. B is content. C is an actor. D is process. E is evaluation. Anyone? It's B is context. A country is struggling with an increase in tobacco-related illness. You tasked with formulation of a policy. What would the most critical first step according to the health policy triangle? First, implementing smoking cessation program, conduct policy evaluation. C is setting the agenda to highlight the issue. D is creating public awareness campaign. E is consulting with tobacco campaign. It's C, setting the agenda to highlight the issue. MCQ 3, a new health policy is being debated at the national level. As a public health expert, you are asked to provide input and possible impact of policy on healthcare delivery. Which health policy analysis framework would you use to structure your impact input? Primary care model, Mosby healthcare models, health system models, public health intervention pyramid, and health policy triangle. It's E, health policy triangle. During the development of health policy for family planning survives, you realize the policy fails to address rural healthcare access. Which element of health policy triangle is lacking? A is process, B is context, C is actor, D is content, E is evaluation.
E.
It's D, content. The government has launched a new national program for malaria control. After several years, it's clear that the policy has not reduced malaria incidence. What should be the next step? Revise the program, reallocate funds, conduct a policy evaluation, implement stricter enforcement, develop a new policy.
B.
Conduct a policy evaluation.
Yes, but C, conduct a policy evaluation. Most research conducted recently found that rising cigarette prices through increased tax in a highly effective measures for reducing smoking among youth, young adults, and persons of low socioeconomic status at government level. At which level this policy works? Meso level, macro level, micro level, primary level, and community level. It's B, macro level. A new policy focusing on healthcare quality has been introduced. The policy requires continuous monitoring of healthcare outcome. Which stage of policy cycle is this? Policy formulation, policy implementation, decision making, policy evaluation, and agenda setting. It's D, policy evaluation. You are asked to propose a vaccination policy for a rural community considering the limited resources. What type of analysis should be performed to determine the policy feasibility before implementation? Retrospective analysis, uh, prospective analysis, ethical analysis, policy evaluation, and financial analysis.
B. Retrospective analysis.
It's a prospective analysis. A healthcare program aimed to reducing infant mortality was launched. Midway through, the program has faced significant operational challenges. Which element of the health policy triangle should be reassessed? A is content, B is process, C is context, D is actors, and E is evaluation. Let's B,
The process.
process. Yes. In developing a new public health policy for controlling infection disease, the government is collaborating with the international organization and donors. What category does this policy fall under? Vaccination policy, national health policy, mental health policy, pharmaceutical policy, and global health policy. It's B, global health policy. Yes, it's B. This is key over MCQs. This is our YouTube channel link. And thank you very much for listening.